I'm Joe Simone, and I'm the president of Simone Development. Simone Development is the premier developer in the New York metropolitan tri-state area for healthcare facilities. What we do is fairly unique because we've been doing what we do for over 25 years. We can do everything from site selection to development to construction of the project, as well as finance it, and then we can manage it.
What makes Simone Development and Simone Healthcare Development unique is that we have many, many years of real estate industry experience and many years of healthcare understanding. And you put those two together, you do become experts in finding sites that work best for a hospital or a group medical practice. What makes us special is the ability to find, approve, design, and construct a property in 15 to 20 months. We do it in a very cost-effective and time-effective manner, and in this period of rapid change in the healthcare industry, that's very important to our partners.
Most hospitals were built at or around World War II vintage. The populations then were in a certain location. Over the years, there's been a tremendous amount of development. Now the population has shifted. So now we have to place facilities where the new population is, not where it was.
Right now, medicine is undergoing a major transformation. We are moving from a hospital-centric to an ambulatory care-centric model. What this means is that we need to build new, large, and dynamic facilities to accommodate this change in healthcare. Simone has been an important partner with us and others in this area in building those kind of facilities, getting ready for the fundamental change in healthcare today.
Joe is the kind of developer that wants to be ahead of the curve. He wants to know where I'm thinking, and he's out there looking for properties for me in a style of property that, again, meets the needs that I'm looking for.
When we find a pre-existing facility that can be altered, the timing associated with that is generally 12 months. If we have to build ground up, it's generally 18 to 24 months.
What has been most impressive about Simone is that they're able to identify space where it would seem that there is none. It's very easy to find developers who will look for open parcels of land. But in major metropolitan areas, you don't find those sites on a regular basis. You have to create a site.
Joe has come to us with a property that we really believe can be one that fits our needs. The next step is working with Joe and his team of architects and designers to look at how we would build out that space, get a handle on what are the costs involved in building out that space, and then sitting down as a team to say, okay, how are we going to put that into a long-term lease that fits both the developer's needs and the needs of our private practice.
Because we bring the financing element to the hospitals and large medical groups, it affords them the ability to be buying medical practices with those funds or putting their money in technology and equipment.
The most monumental task that we had was the creation of a radiology practice once again in a new environment. It's not like moving in desks and moving in shelving and chairs. We're talking about moving in equipment that weigh up to 83,000 pounds. We needed power, we needed an HVAC system. Joe and his development team understood my needs, they understood my concerns with redundancy that we cannot afford to go down. We were able to open up our practice once again within 4 months.
We are now completing the first bedless hospital in the United States for Montefiore Medical Center. This bedless hospital is a big deal. It's a big deal for the hospital because it recognizes the advances in technology and will lower costs. And it's a big deal for patients who no longer have to stay overnight away from their jobs or families. They can come in the morning, have their procedure, and be home later in the day.
Joe Simone knows my taste. He knows how I like to do things. And his team is doing everything they can to absorb what we're trying to put into play here. So in many ways, they know how to translate ideas that we express differently than developers might think about, but they hear it and then they put it into action.
We believe that quality is of utmost importance, and that today people appreciate quality when they come into a medical facility. They're not feeling good at that moment, so we have to give them things to feel a little better about.
The patient experience is a very important part of healthcare today, and it is the right experience, the right ambiance, the right involvement that makes a patient feel that they're in a therapeutic atmosphere.
Simone Development has been building hospitals and medical facilities for over 20 years. We understand the needs of the hospitals, we understand what the doctors need. More importantly, we understand what the patient experience is about.
We are continually meeting with our healthcare partners to discuss trends and strategies for the future. The healthcare industry is not static, and we need to continue to look forward and be ahead of the curve.
We at Simone Development understand that the needs of healthcare has been changing rapidly. We're here to try and assist in facilitating these new needs.